I'm Dr. Chris Hardy. I have a little bit of an unusual background that I started med school late. So I was a military diver first and did underwater construction. I always tell my patients I actually worked for a living first before I became a doctor. So afterwards, I started college at age 25, went to Old Dominion University and did my studies in biochemistry. Went to Naval Medical Center Portsmouth, actually. Went back in the Navy as a Navy doc. Did an internship there, and then did 4 years in the fleet as a ship's medical officer, including several deployments to Iraq and Afghanistan. Then I went to Johns Hopkins University for my residency training in occupational environmental medicine. As a specialty, occupational and environmental medicine has a big breadth to it. So it's not, you can see anywhere from musculoskeletal injuries to a chemical exposure on the same day. So academically, it's very interesting. And it's very challenging too. It's more like a little bit of detective work, especially with exposures. I was pretty tired of moving after 2 to 3 years, for 13 or 14 years, it gets old. And we wanted to set up roots in the Northwest. And Everett Clinic had an excellent reputation. The first thing I saw was the first of the core values, do what's right for the patient. And that kind of sold me. And then I had to make sure that they actually lived up to that. And I found that they do. So I'm very, very happy I made this decision. I've been out there, worked hard for a living, been injured on the job, so I know what it's like to go through that. I got interested in back pain because I've had back pain for several years, and it helps me empathize a little bit with what's going on, so I think that's helpful.